So Cypress Hematology Oncology practice started 6 years ago as a small practice with the idea that we will provide very personal care for the patients, where each patient is treated as a person, not just as a number. Hematology is practice of blood diseases, whatever that could be a benign disease or it could be malignant.
Oncology predominantly focuses on the care of cancer patients. And both Dr. McHale and I are double board certified in both hematology and oncology, so we see both types of conditions.
When we treat cancers, a lot of these patients develop hematological problems. So if you're really very well trained into it and you know what to do, it makes it much better for the patients.
And as part of our job, we have to be ready to see every type of hematologic or oncologic illness that's out there.
The treatment nowadays is very specialized, and the training allows for providing the appropriate treatment for the patients.
Our practice is not what you would call a mill, where large volumes of patients are run through the office and into the exam rooms and the infusion room. It's a smaller practice, and we like to think it has a more personal feel to it for our patients, and I think that definitely sets us apart.
What's really unique about the Cypress practice is the warm environment, the special patient care that they receive in here, the convenience of the treatment, the warm staff.
We have a whole team of people here taking care of each patient. It's not just the doctors who are caring for the patients. Our front desk gets to know the patients very well, our medical assistants, our chemotherapy nurses, and our nurse practitioners.
I think Cypress is a special place because we are a small enough practice that we're able to provide personal care. We know our patients by name, not by number, and all of us have specialized education, so we still provide good care, but personal care as well.
The office doesn't only care for the medical treatment of the patient, but also the social treatment for the patient, the mind, the soul, the well-being of the patient.
The patients really make it special. They're very welcoming. They are very thankful for everything that you do for them, and that makes coming to work very enjoyable.
The primary thing that tipped me over towards this was the close relationships that you form with your patients, and not only is that just satisfying in of itself, but it helps sustain you as a physician.
Every patient who steps through the door here are known by name to the staff. Almost the staff knows everything about the patient, maybe even about their families. They are taken care of in a way where it's not just the patient and their families and so on.
Patients definitely become part of our family. We see our patients for a long time. We follow them for life normally. And so we come to care about our patients. We care what happens in their lives. If they have new children born or grandchildren born, it's all part of us as well.
The patients are in great need, but the patient who are not going to complain. They are very resilient, very strong. They are ready to fight. They look into life in a very different way than everybody else. I learn a lot from them. I think oncology has changed my own life.
We have all of our patients do an extra teaching session prior to starting on their treatment.
I hope my cancer patients understand the treatment process by providing education. Education is very important to us here at Cypress.
We help the patients understand their treatment process by spending an hour with them and educating them on the chemotherapy that they're about to receive, the side effects of the chemotherapy, and ways to help those side effects.
What kind of food they could be eating, what kind of activity could they be tolerating during their treatment, is it okay to be around children or not? All these questions get answered during that setting as well.
We also make sure our patients know how to contact physicians if needed, and let the patients know that we are always here if they need someone.
It's a lot of information for patients to digest, and that's why we have people come back several times to go over all of the information with them.
Cypress is located in a very convenient place because it's in a cancer center where diagnostics, medical oncology, radiation oncology, surgical care are all provided in the same place.
Porter Cancer Care is a great place to have care because everything is comprehensive in the same building.
We're part of a cancer center for which there are few like it in Denver. where we have access to an integrated model of care.
Being a part of Porter Comprehensive Cancer Care makes it easier for patients because they're able to get their scans and all their tests in one place. That makes it easier for the physicians and myself to access that information, helping provide better patient care.
We work as part of a multidisciplinary team that involves multiple physicians and other members, including dietitians, speech therapists, counselors and genetics counselors, amongst others.
Instead of having the patient go see multiple different specialty, we can actually get the opinion for the patient in one conference and come back and discuss that with the patient. We also have an inpatient unit that specializes in cancer care.
So it's really a very neat place to practice because we have such tremendous resources available to us. There's been an explosion in new cancer treatments over the last 10 years, which is extremely exciting for our patients. We are actually participating in a number of clinical trials that are studying some of these new drugs.
We participate in the Colorado Cancer Research Program to be able to provide the patients with the newest advances in cancer care, where we now have targeted therapy, we have antibodies, which really target the cancer alone without targeting other cells. It has much less side effects.
We feel it's a tremendous benefit for our patients because it allows us to offer our patients the advantages of a personalized pattern of care here in our practice.
We cannot advance without the clinical research. This is part of what we do every day, and it's very important for our practice.
So our philosophy of care here is not only to provide top-notch care based on the latest data and research, but also to form a close personal bond with our patients. At the end of the day, we want to make sure that our patients are well informed and understand everything that is pertinent to their care, but also feel like we are really looking out for their best interests.